This broadcast is brought to you by Colby Brooks with Century 21 Right Pace Real Estate and buyfrombrooks.com. Let Colby Brooks handle all of your real estate needs. Well, Arkansas up to 1,498 confirmed cases of COVID-19, that including 1,024 active patients as of today. We're breaking down the numbers, showing you important maps, and telling you where each county is as of at least the latest data that we have next on NEA Report.
Reporting.
It's great to have you in this afternoon on NEA Report. Stan Morris reporting in Jonesboro. We've got the latest news on COVID-19 in Arkansas and breaking those numbers down in a very clear to understand way. Right now, 1,498, that's the number of total cumulative cases of COVID-19 in the natural state. But 444 of those have recovered. So the number of active patients today, 1,024. It's still gone up, right? But it's a number that's not quite as high, perhaps, as the initial number that you see there that's always going to go up and never go down. Unfortunately, there have been 2 more deaths in Arkansas. We want to mention that. So now 32 have died in Arkansas of COVID-19. Over 21,000 tested. We want to mention that out of the numbers because, of course, that doesn't mean everyone tested. That doesn't mean everyone that has it is confirmed. But these are people with symptoms or people with increased risks. So we want to go ahead and make note of that. The latest numbers we have show these numbers. In Craighead County, 36 positive, 15 recoveries, 358 negative tests for the county. In Greene County, 6 positive, 3 recoveries, 335 negative. In Poinsett County, 7 positives, 4 recoveries, and 37 negative. In Randolph County, 8 positive, 6 recoveries, so only 2 active cases there right now, and 161 negative tests. In Clay County, 1 positive, 0 recoveries, 66 negative. In Lawrence County, 11 positive, 0 recoveries, 1 death, and 106 negative. In Sharp County, 2 positive, 0 recoveries, 20 negative. These numbers, the latest from the Department of Health, updated probably last around 10:30 a.m. this morning. The Mississippi County numbers show this: 7 positive, 4 recoveries, 47 negative. Crittenden County, 115 positive, 16 recoveries, 2 deaths. A lot of testing happening there, 602 negative. And in NEA, as we continue mentioning just some numbers quickly here, Jackson County at 1, Fulton 0, Independence up to 6, White County 28, Cross County 7, Izard County 2. Across the United States, the numbers look like this: 592,743 with 24,734 deaths and 44,364 having recovered. The latest numbers from Johns Hopkins. Across the globe, 1.9 million have it, according to Johns Hopkins, or have had it. 124,544 deaths with 469,926 recoveries. New maps at neareport.com for you to check out, including one that's going to be constantly updated. It's something that was made by Google and some others, companies that got together and basically incorporated all the data from Johns Hopkins and other sources, along with population data too, to give us an idea of how many cases there are per capita, not just how many cases there are. It's a county by county breakdown. So if you mouse over your county, even though they're very small here, you can click each individual one and find Craighead, Lawrence, or wherever you may be. So you can also see the hot spots across the United States and how we compare to those too. Now, in daily new confirmed cases across the United States, the peak so far was on April the 4th with 35,000 new cases, right? We want to show this because as we continue to climb to that point, we could have continued climbing after that, but instead we've leveled off in the United States, with yesterday's numbers showing 25,000 new cases, and the day before that showing 26 or 27,000, the day before that at about 31.5. So the numbers could continue to grow, but seeing them level off in this manner could be a good sign. The governor, of course, of Arkansas saying he thinks we're plateauing today in the state of Arkansas. And we thought that too. At least it looked like that until the test numbers came out yesterday. Those test, as we have heard mentioned many times, the numbers were skewed by the numbers that were at the prison system, Cummins specifically. But still, even with those removed, you would have the largest single day increase for Arkansas yet. 195, as you can see on the map here, provided by Dr. Pat Carroll. That's current as of Monday. It doesn't have today's update in it. But you can see before that, we were at 52, 26, 56, 69, 80. 80 had been the record before the 195 number we got yesterday. The number of active and cumulative cases in Arkansas, even with the increase yesterday, still showing a lot less active cases than cumulative. That's why we always try to mention that number in there. But you can see as the smaller orange line there below the blue line, you can see it did go up. It did spike yesterday with the big increase that we had on Monday of almost 200 cases. Some headlines now related to COVID-19 and in Northeast Arkansas. There's a hotline that's been set up by the Arkansas Department of Health for individuals in the area who are COVID-19 positive but lack a safe place to be isolated or quarantined. That news was announced by the Jonesboro Grants and Community Development Director Regina Burkett on Monday. Anyone in the situation should call the hotline number 501 614 5822. The ADH has a process in place and will determine what steps need to be taken, including providing transportation for someone who has tested positive for COVID-19 already. Again, that's for people that tested positive but don't have a safe place to be quarantined or isolated. Suddenlink announcing today that it's going to offer Altice Advantage for K through 12 and college students through the end of the school year, which of course we know in Arkansas is going to happen relatively quickly, considering that it's pretty much over with. But they've announced that this is going to go until June 30th, 2020, to ensure students have reliable access to high-speed broadband connectivity. The company's also announced they're joining the Keep Americans Connected pledge, which will provide relief to residential and business customers disrupted by the pandemic. According to this press release, this is what they're doing anyway. If you disagree, understand, I'm just the messenger. It says open its emergency optimum Wi-Fi outdoor hotspots for public use to non-subscribers. They're collaborating with large hospital systems, schools, and government agencies to ensure they have connectivity services that they need to assist the public during this time. That includes waiving fees for first responders and other critical entities. They're also announcing they're providing free airtime for public service announcements for a number of health and community organizations and government officials. They've made a website, news12.com, kind of an odd, maybe there's a purpose behind that domain, I don't know. But anyway, it's available to all residents to basically find out school closures, government press conferences. They've made a news website, right? And they're delivering free previews of select networks, they say, with live and on-demand content for everyone, which is basically just a way to give you more stuff to watch. But anyway, if you'd like more info on that, neareport.com. Well, the ag sector is taking a hard hit from the pandemic, according to Talk Business and Politics and our friend George Jarrett, who reported that COVID-19 is not just hitting industries that are everywhere across the world. Here at Arkansas, we're seeing the farm industry taking a lot of impact from this. And an impact report, in fact, was released by the University of Arkansas System Division of Agriculture. From the milk to the protein industry, it's been really hit hard, especially with the closing of so many restaurants. One estimate said that the protein industry, like beef, cattle, that kind of thing, up to 50% of that would have been bought by restaurants. Imagine 50% of your buyers vanishing overnight for your business. So more at neareport.com or at Talk Business and Politics website. You can find the link at ours. Obesity is one of the single biggest chronic factors in New York City hospitalizations for COVID-19. And as you know, if you followed us, New York City having more hospitalizations than any other country except for the United States, where they're, of course, a part of. But they're saying age is the worst, and we've known that for a while. However, the second worst contributing factor, which a lot of people think means something very bad, and it clearly doesn't necessarily mean something that rare. Obesity is an issue a lot of us, probably myself included, have. And so, two biggest deciding factors: the first, age; the second, obesity. According to ZDNet, they're a long time technology website that's been out there, but they were linking up a study that I should point out has not been peer reviewed, but it's of course early in the process for this whole thing, so it wouldn't have had time to have been done that yet. But they're saying the chronic condition with the strongest association with critical illness was obesity, with substantially higher odds than any cardiovascular or pulmonary disease. So it's interesting stuff we thought you might be interested in hearing about. Well, Craighead County revenue is going to plunge due to COVID-19, and probably not just because of that. The tornado is not going to help anything in that relation either. But most of the businesses, as we know, that were hit were already shut down because of COVID-19. So it's affecting the revenue stream for the county and delaying some projects in the process. The Jonesboro Sun reported on it, and we linked their article at neareport.com. A big story that came out today from St. Bernard's: they're going to be making cost-saving cuts that will include furloughs. A statement from the CEO, Chris Barber, was released today to all press outlets. I think KIT first reported this, so they deserve credit, and I want to give it to them. It says, as we prepare for a potential surge of COVID-19 patients in NEA, St. Bernard's Healthcare stands ready to offer medical assistance to any person who needs it. But he also said the sober reality with COVID-19, however, is that to properly address the virus's health component, economic norms must be changed too. Many businesses across our country and state have added protections for their workers at additional expense while suffering the loss of revenue from routine sales and services. Quote, St. Bernard's has always been a good steward of available resources, but we are no different than other healthcare providers across our state in navigating this challenging environment to fully comply with all state and federal mandates and guidelines, which a lot of those, by the way, he's referencing will include non-elective surgeries being canceled or postponed. That's a big cash cow for medical providers. He says, quote, we have presently ceased elective procedures and surgeries while also closing several facilities. And this is talking about not just the big St. Bernard's Hospital. This is talking about the St. Bernard's Health System, the whole thing. Furthermore, quote, our patient volume at St. Bernard's Medical Center and our outlying clinics have experienced an understandable substantial decline. Specifically, our health system overall has seen declines ranging from 35 to 70%. We have additional COVID-19 demands to equip our healthcare workers for a potential surge, but it's got to be pointed out that surge has not happened yet. However, they have seen the opposite of a surge, right? Just a total drop in average everyday business because of the measures that have had to have been taken to prevent this thing from spreading and from them having the surge. The alternative, it's important to point out because someone will see this and they will say, well, that means we shouldn't have shut anything down. Well, the alternative was make no decisions that change business. They stay in business. And then not only do they have everybody normally in there, but then they have 10 times the amount of patients that they have now because of social distancing. You can see some links there if you ever want to get on neareport.com and follow along with the governor live during his press conference. Finally, one announcement or one alert that was actually sent out by the Attorney General announcing to be wary of middlemen promising protective equipment from foreign manufacturers. The Attorney General, Leslie Rutledge, saying that any business transaction, we should always be cognizant of deals that are too good to be true. She says as state and local governments, hospitals, healthcare organizations, and businesses have worked to acquire that PPE that we hear so much about, personal protective equipment to protect their employees and citizens, many middlemen businesses have arisen to broker deals with foreign manufacturers to supply that desperately needed equipment. It says these brokers purport to offer approved masks, face shields, gowns, and mass quantities, but they're at an inflated price. It says that many brokers can't verify the quality of the stuff or the authenticities because it's coming from an overseas source. So there's tips online to avoid getting scammed from this, finding examples of unapproved or counterfeit masks. And this stuff is important for a lot of, especially industries like the healthcare industry, but others that have this day-to-day contact with folks. Try to be careful. Don't get scammed. You don't want to order a mask that is coming from some kind of backroom factory in an overseas country that may have a large concentration of this stuff. Or at least you would think they do, but generally speaking, they don't announce it, right? So those are some headlines related to the coronavirus today from NEA Report. We're glad you've been in with us this afternoon. Thanks, everybody, for joining us. And if you think we did an okay job with all the effort we put into this afternoon, maybe a like or a share, it would mean a ton to us. Thanks so much for subscribing as well, if you do on YouTube. And if you're a supporter on Facebook, well, we really love you. And we'll have some exclusive stuff for you this Friday at 7 p.m. As we always do, we always have an exclusive show every week for our supporters. It's Dan Morris reporting in Jonesboro, and we appreciate you for joining us today on NEA Report. I'm checking just one more time to see if they had updated county-by-county numbers on the Department of Health's website. They still have not yet, but they will later this evening or later this afternoon. And so if you want to see those, neareport.com. And now you're up to date from NEA Report.